Hello, this is Martha Yassemedis, and this is my MAPIT project for Oak Ridge, Tennessee for Nursing 383 Population and Global Health Perspectives for the Registered Nurse. According to Healthy People 2020, more than 80% of adults do not meet the guidelines for muscle strengthening and aerobic physical activity. It also notes the need for increased physical activity across all age populations and notes that regular physical activity can improve the health and quality of life for all Americans. Among adults and older adults, regular physical activity can lower the risk and complications of early death, coronary artery disease, stroke, high blood pressure, type 2 diabetes, breast and colon cancer, falls, and depression. Now, although Healthy Government, if you could look in their website, it breaks down the physical activity into different age populations. We're going to be mainly discussing adult populations. According to Healthy People 2020, the following positive factors are associated with increased adult physical activity. So most people with higher income, enjoyment of exercise, an expectation of benefits, a belief in the ability to exercise, history of activity in adulthood, social support from peers, family, or spouse, access to and satisfaction with facilities, enjoyable scenery, and safe neighborhoods will all increase the opportunity or the use of adults enjoying physical activity. Some of the factors that are negatively associated with adults and physical activity include advancing age, low income, lack of time, low motivation, a rural residency, hence they don't have the opportunity or the resources, a perception of a great effort needed for exercise, either overweight or obesity, perception of poor health, or being disabled. The way we're going to mobilize this activity is we're going to get a bunch of the community members, such as the City of Oak Ridge Parks and Recreation Department, Methodist Medical Center, Anderson, and the Roane County Health Departments. Oak Ridge is actually divided into two counties. The majority of Oak Ridge City is in Anderson County, but there is a portion of the west end of the City of Oak Ridge that is in Roane County, hence the need for the cooperation of two different health departments. Peninsula Behavioral Health. Oak Ridge has many local health and fitness clubs, so we're going to get those to participate also. The Oak Ridge Senior Center and the Oak Ridge Community Center. Pharmacy centers, local healthcare personnel, nursing program students, and concerned citizens with a vision and a mission to, number one, educate health residents. Our target population is going to be age 30 to 70. Those living in Oak Ridge, Tennessee, and we're going to try and educate them on the benefits of regular physical activity. We're going to also educate residents on the local resources available for participation in physical activity. We will provide information on health conditions benefited by regular or increased physical activity, and of course, promote a healthier lifestyle. And other ways we're going to mobilize this is we're looking at who will be affected by our coalition and how are we going to reach our targeted population. Our targeted population will be adult members ages 30 to 70 that live in Oak Ridge, Tennessee. And we will partner with the above aforementioned organizations to provide educational information to our population. One of our goals is to promote a healthier lifestyle, including physical activity, that will benefit not only adult populations, but the general public as well. We're going to look at increased activity as being linked to improvement in chronic health conditions, promoting a sense of mental health, well-being, as well as physical well-being. And as Durstein and his group said in a study that I looked at, physical activity is considered a primary preventative measure for chronic disease. And if you read the textbook, you realize that primary prevention is a big push in education or health education and healthcare today. How are we going to assess this? Well, let's look at our community. There are many walking, jogging trails, community parks, and recreational facilities in the City of Oak Ridge, including an indoor pool, which is located in Oak Ridge Civic and Community Center, and an outdoor pool, which obviously is going to be open only during the warmer months. Some of the city's parks are well lit. They have exercise equipment both for adult and children. A few are even handicapped accessible. There are also a lot of greenways in the City of Oak Ridge, some of them associated with various communities. Some of them are lit, but most are not at night, and they may not be accessible to the disabled. The Oak Ridge Civic and Community Center that I mentioned before that has the indoor pool also offers indoor and outdoor walking trails. If you pass by the Oak Ridge High School, you may see those trails, or at least the outdoor one across from the high school. They also offer exercise classes. And Mountain Hill Lake Park, which is right next to Mountain Hill Lake, offers jogging, cycling trails, rowing, and exercise equipment. Now, according to Oak Ridge demographics, our population has the following statistics on health and nutrition. Our average BMI is 28.2%, which is a little bit higher than the state average of Tennessee's average. Our adult obesity is 28%, again higher than the state of Tennessee. Residents are 34.5% overweight, again higher than the state average, and a diabetes rate of 13.5%, which is slightly higher. The healthy diet, 52.6%, is actually below the state average, which is a good thing in that respect, because it shows that more of us are actually trying to at least, or say that we follow a healthy diet. According to the Centers for Disease Control's National Health Report that was published in 2014, looked at the statistics from 2005 to 2013, and they found the following 10 diseases were the leading cause of morbidity and mortality in the United States. Diseases of the heart, malignant neoplasms, chronic lower respiratory diseases, CVAs, unintentional injuries, Alzheimer's, diabetes, pneumonia and influenza, nephrotic syndrome, and self-harm. If you notice, again, diabetes is slightly higher incidence here in Oak Ridge than it is for the state average. And I was kind of looking at diabetes because in the family assessment that I did, the family member did have diabetes as a diagnosis. We are looking at 3 specific behavioral risk factors that we identified in this community, and they include decreased physical activity, low motivation, and a perception of a greater effort to exercise. So what are we looking at? Some of our resources in our community. Oak Ridge is very fortunate to have numerous medical facilities. We have Methodist Medical Center, which is a large Covenant hospital, at least 3 to 4 fitness centers at any given time, walking trails and greenways that I mentioned earlier, and indoor and outdoor exercise facilities. We have an abundance of medical professionals and a local hospital that I mentioned. And we have low-cost options at the community center for activities. So you can access Welcome to Oak Ridge, Tennessee on the web, and it will indicate the cost of attending some of those activities. But some of the needed resources that I identified were we need more handicap-accessible greenways and trails, better lighting and better safety measures for facilities after dark, and the ability to provide information in a community-wide manner to reach more residents. Our plan and goal is to educate and encourage the adult population ages 30 to 70 living in Oak Ridge to increase their physical activity, or even to begin physical activity, and be aware of and utilize the resources available here, thereby reducing their morbidity and mortality. Our timeline, the program is going to last approximately 6 months. What I'm looking at is getting information obtained from logs and surveys that will be provided to the participants, and physical measurements that can be analyzed at the end of the program. Although several types of data will be measured, the goal is just to determine at this point if the program increases physical activity. So by looking at the participation logs, we will be able to determine if the participant has increased their activity. However, we'll be on the honor system, obviously, because we're not going to be able to visually see these people commit or participate in these activities. It's not typed in here on my plan, but what I was looking at mainly doing is contacting people at the different facilities and seeing if we can get them, if they're interested, and then give them log books. And I'm going to go explain that a little bit more, and be able for them to participate in just almost like a fitness tracker, but in a log form. Our funding is going to be application for available funds from local and state public health resources. We'll accept any donations from the local health personnel and facilities that we would contact, and any concerned citizens. Oops, sorry about that. An RN will serve as a point of reference for all shareholders. A program brochure is going to be developed, printed, and distributed to the facilities such as the hospitals, grocery stores, community centers, the public library, fitness centers, pharmacies, gas stations, and medical facilities. We're going to outline the need for and the benefits of regular physical activity and provide information on the resources available to them for the use of safe trails, facilities, etc. for exercise. The opportunities will be available to sign up for fitness tracking, and logs will be available for participants to participate and develop their fitness goals and track their progress. So for ease of tracking, the first thing in the official program, only those participants who sign up will be monitored. However, all adults, community-wide, will of course be encouraged with the permission of their physician to increase their physical activity. Local vendors will be given the opportunity to participate in any awards for goal completion, such as a free car wash or a decreased cost of renting a facility for pool parties or other rewards. Monthly meetings will be held for the shareholders that I mentioned earlier to develop and provide updates during the development and implementation phases of the program. We'll send out emails updating information for those who cannot attend meetings. Weekly attendance for participants will be obtained at indoor facilities, such as sign-in sheets and stuff at the community center and the indoor and outdoor pools. Participants will be encouraged to maintain their fitness log, especially when using the outdoor facilities that are not as easily monitored. Prior to sign-ins and the kickoff of the program, a date for healthcare personnel will be available to provide information and measurements of height, weight, BMI, and counseling of realistic safety goals and activity goals for participants. Participants will be required to provide authorization from their physician prior for implementation of the fitness activities. And of course, this is just to make sure and decrease any legal liability. A kickoff event such as a carnival or just an information health fair will be an information seminar will be held prior to initiation of the program. And we'll have some refresher information periodically provided during the program also. We hope to include and encourage local nursing programs, school programs to make their students available for participation. This will help them in their clinical hours and help get the information out a little bit easier. What we hope to accomplish is some personnel will be available to answer any questions. We'll have some poster presentations. Fitness logs will be provided. Door prizes. That always encourages some folks. Information on healthy living and eating. And participants may sign up for email reminders and information. We're going to track our sign-in sheets. Sign-in sheets from the indoor facilities will be tracked weekly and developed into a monthly report. Participants will be encouraged to provide monthly feedback by use of a survey, and we're going to use that via email or monthly meetings. And probably should add in a drop-off point for those people who do not have or participate in computer work, email, such. We're looking to track increased physical activity to see if any of them did attain their physical activity goals. And again, we're looking for realistic goals, especially for those as we get a little bit older in our age population. Those who are wanting to focus on decreasing their BMI and weight, did they achieve that? And this is one of interest for me specifically. Do they report increased personal satisfaction? Do they feel good about themselves? Do they feel like they emotionally and mentally are getting their goals, even if maybe their goal is not to lose weight, or even if maybe it is and they don't lose weight, but just they still feel better about themselves? Have they increased their participation in healthy habits, such as proper diet, getting their fruits and vegetables, drinking more water? But the focus is going to remain on increased physical activity. Perceived and or increased tolerance to exercise. It's very important, especially as we get older. We just don't exercise as well and last as long. So do these folks, do they see that they are improving in that area? Do we need to change or update their fitness goals? If someone wants to walk the community center's outdoor track in so many minutes, have they actually surpassed that? And do they want to go a little quicker? And of course, always being able to answer any questions or comments, concerns regarding the program. Data will be assimilated by students in a statistics course from the local branch of the Roane State Community College, and progress during the program will be released periodically. We can do this by means of poster updates at the facilities and newspaper releases on the Parks and Recreation website. Also, we could possibly get those out at the community centers, some of the senior facilities, the YMCA, and things such as that, maybe even school systems, to encourage adults to participate. At the end of the program, data is going to be evaluated to determine, number one, did an increase in physical activity occur for the targeted population? Did those participants note that they did indeed increase their physical activity? What, and this is of interest specifically, what age population demonstrated the greatest increase? Was it the younger people? Was it the older ones? What age population demonstrated the least increase in physical activity? And did any population demonstrate a decrease in physical activity? Were they just not able to do it and gave up? Data provided after the program will be given to the community and will include results such as the progress made for participants during the program. What did we learn from it? What can we do better? And we can also take the community, give them the opportunity to provide feedback. What did they feel like we didn't do well? What do they want to add or take to or away from the program? And we can do that in the form of an email, give them a mailing address, or even have boxes, like suggestion boxes set up at the local facilities to see what their thoughts are. Our conclusion is that Oak Ridge, Tennessee offers a ton of options for residents of all ages to participate in physical activity. I've lived in Oak Ridge for about 6 years now, and I live in an area where you see a lot of cyclists, not only on the turnpike, but I live in a very hilly area, and you see them come through our neighborhood to challenge themselves to go up and down through the hills. We also have a lot of people walking in the area. But when I went around to the community areas, kind of on my, I don't know if you call it a windshield survey or not, I noticed that you don't see a lot of people using some of the facilities. At the walking trail, for instance, at the Civic Center, maybe there's a handful of people on that trail at any given time. I'm sure, with warmer weather, I would have probably seen more people walking. But, going by the various gym activities and stuff like that, are there a lot of cars? Perhaps I wasn't there at the right time, but it just did seem as if there were not that many people using that, the facilities that we have and just the outdoor resources. Our emphasis is on promotion of educating the community on the benefits of physical activity, and we need that. We need to continually get that out there because obviously some people are not doing that with the fact that our obesity and overweight factors are higher than the state average. It's anticipated that if we utilize the program, we would increase interest and knowledge in the benefits and resources needed for participating in various forms of physical activity in the community. One of the main pushes of a community health nurse would be, of course, to educate the community on benefits. And we're trying to do the primary prevention thing in here and getting that word out to help decrease comorbidities and mortalities and stuff. So I'm hoping that a program such as this, if it would be presented, would show that people were increased. And even if they do have an increased desire, but don't know really how to go about it or where to go or the cost, we can provide that information which might increase their participation. Thank you very much for listening to my presentation. I hope that you learned something or you were interested in maybe increasing your physical activity also. And if you have any questions or comments or concerns, just contact me via Canvas. Thank you very much.